He was 64 years old, a retired teacher. Still walked his dog every morning, checked his blood sugar twice a day, took his metformin exactly as prescribed, did everything his doctor told him to do. And then one morning, he noticed a small blister on his heel. Nothing dramatic, just a little red spot the size of a dime. He put a bandage on it and went about his day. 3 weeks later, surgeons were discussing whether they could save his foot or if they needed to take the leg above the knee. Stay with me. Most people with diabetes think the biggest danger is high blood sugar itself. They focus on the numbers on the glucometer. They worry about A1C results. They count carbs, and those things matter. But the blister on that man's heel didn't care about his A1C. It cared about something else. Something that nobody had explained to him in 20 years of managing his diabetes. And what I'm going to tell you today could be the single most important piece of information you receive this year if you're over 60 and living with diabetes. My name is Dr. Michael Harrison. I'm a vascular surgeon with 32 years in the operating room. I've performed over 2,000 limb salvage procedures. I've held dying tissue in my hands. I've stood across from families at 3 in the morning explaining why we couldn't save their father's leg. And I've spent those 3 decades watching the same preventable pattern repeat itself in patient after patient after patient. People who managed their diabetes beautifully on paper. People who followed every guideline and still ended up losing limbs. Today, I'm going to tell you what nobody took the time to explain to them. What nobody explained to Richard. Here's what changes in your body after 60 that makes diabetes exponentially more dangerous. Your blood vessels don't heal the way they used to. That's not vague aging talk. That's a specific biological reality. When you're younger, even with diabetes, your body has redundant systems, multiple small blood vessels that can compensate when one gets damaged. Think of it like a city with backup roads. If one highway closes, traffic finds another route. But after 60, those backup roads start shutting down one by one. Your body loses that redundancy, and diabetes accelerates that loss. By the time you're 65 with 20 years of diabetes behind you, you might have half the small vessel network you had at 45. Half. The margin for error gets smaller. And smaller margins mean a tiny injury that would have healed in a week at age 45 now becomes a wound that won't close at 65. More than 70% of all diabetes-related amputations happen in people over 60. Not because they manage their disease worse, because their bodies no longer have the reserve capacity to recover from mistakes. Now, let me walk you through the 5 things that put diabetics over 60 at catastrophic risk for limb loss. These are not rare exotic complications. These are ordinary daily patterns that millions of people are living with right now. And every single one of them is preventable, starting tonight. The first one is foot inspections. And I can already hear you thinking this sounds too simple, like something too basic to matter. But here's what nobody tells you. You cannot feel the injury that will cost you your leg. That's not an exaggeration. It's not fear-mongering. It's a neurological fact. Diabetic neuropathy means the nerves in your feet stop sending accurate pain signals to your brain. A blister that would wake up a healthy person in the middle of the night with throbbing pain doesn't register at all in a diabetic foot with nerve damage. You can walk around for days on an open wound and never know it's there. The warning system that protected you your entire life is gone. And most people don't realize it's gone until it's too late. I had a patient last year who came to me with an ulcer on the bottom of his foot that had been there for 11 days. 11 days. He had no idea. He felt nothing. When I asked him when he last looked at the bottom of his feet, he couldn't remember. He assumed if something was wrong, he would feel it. That's what everyone assumes. Pain is how your body tells you something is wrong. Except when you have neuropathy, that system is broken. That assumption cost him his second toe and 3 months of wound care. 3 months of daily dressing changes, 3 months of antibiotics, 3 months of wondering if the infection would spread further, all because he didn't look. Here's the mechanism. High blood sugar damages the smallest nerves first, the ones in your feet. The farther from your heart, the more vulnerable. Those nerves die quietly. No dramatic symptoms. Just a gradual loss of sensation that creeps up from your toes toward your ankles over the course of years. By the time you're 65, if you've had diabetes for 15 or 20 years, there's a very good chance you've lost significant protective sensation in your feet. Protective sensation, that's the medical term for the ability to feel that something is wrong before it becomes catastrophic. And when you lose that, every step you take is a gamble. After 60, this is worse because your skin is thinner. Your immune response is slower. Your circulation is compromised. A small blister that your 40-year-old body would have walled off and healed in 5 days now sits there open and exposed, a perfect breeding ground for infection for a week or more. And you feel nothing. Let me ask you something. When was the last time you looked at the bottom of your feet? Not glanced at them in the shower. Really looked. With a mirror if you need to. Check between every toe. Ran your hand over every inch of skin, looking for anything that feels different. Most people have never done that. Not once. The fix here costs nothing. Every single night before bed, inspect your feet. Both feet. Use a mirror if you can't see the bottoms clearly. Look for redness, blisters, cuts, dry cracks in the skin, anything that wasn't there yesterday. If you find something, even something small, you call your doctor the next morning. You don't wait to see if it gets better. Because in a diabetic foot, things don't get better on their own. They get worse. And once infection takes hold in damaged tissue, the clock starts ticking. Write that down. Daily foot inspection, not weekly, daily, starting tonight. 2. The shoes you're wearing right now. Let me explain something that sounds dramatic but isn't. Your shoes are probably hurting you, and you don't know it. Here's why. Diabetic neuropathy doesn't just kill pain sensation. It also kills position sensation. Your brain stops getting accurate feedback about pressure points. A shoe that's slightly too tight in the toe box creates a pressure point. In a healthy foot, that pressure point causes discomfort within an hour. You adjust the shoe or take it off. Problem solved. In a neuropathic diabetic foot, that pressure point causes tissue damage within an hour, and you feel absolutely nothing. The skin breaks down at the cellular level. A blister forms. The blister opens. Bacteria enter. And the first time you realize something is wrong is when you see blood on your sock 3 days later. I've seen patients lose toes because of new shoes they wore to a wedding. Dress shoes they hadn't worn in months. The shoes fit fine 5 years ago, but feet change. Diabetes changes foot structure. Bones shift, arches collapse, hammer toes develop. The shoe that was perfect at 55 is a weapon at 65. And because you can't feel it, you keep wearing it. This is the most preventable injury pattern I see, and it happens constantly. After 60, your foot structure is less stable. You're more likely to develop deformities, bunions, bone spurs, Charcot foot. Any of those creates new pressure points. And if your shoes weren't fitted for your current foot shape, they're creating trauma every single time you put them on. Here's what I tell every diabetic patient over 60. Go to a certified podorthist, not a shoe store. A podorthist, someone trained in diabetic foot care. Get your feet measured, both feet, because they're probably not the same size anymore. Get fitted for diabetic shoes. Medicare covers this. Most insurance covers this. There's no reason not to do it. And once you have proper shoes, you inspect them before you put them on. Every time, run your hand inside the shoe. Feel for anything that shouldn't be there. A pebble, a seam that's come loose, anything. Because you won't feel it once the shoe is on your foot. I had a patient who walked around for 2 days with a thumbtack in his shoe. A thumbtack, driven half an inch into the bottom of his foot. He had no idea until his wife saw blood seeping through his sock. That wound took 4 months to heal. That's the reality of neuropathy. You have to see the danger because you can't feel it. Now, this next one surprises people every time. And item 4, that's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. 3. Blood sugar control at night. Most diabetics are obsessive about their morning fasting glucose. They check it first thing. They adjust their medications based on it. They feel good when it's in range. But here's what nobody tells you. Your blood sugar at 3 in the morning matters more for your feet than your blood sugar at 7 in the morning. Let me explain why. Healing happens at night. Tissue repair, immune response, cellular regeneration. All of that peaks between midnight and 6 a.m. That's when your body is supposed to be fixing the micro damage that happened during the day. But if your blood sugar is elevated during those hours, that healing process shuts down. High glucose is toxic to the cells responsible for wound repair. It's not just that healing is slower. It's that healing doesn't happen at all. After 60, this is catastrophic because your baseline healing capacity is already reduced. You don't have the margin to waste 6 hours a night with impaired tissue repair. A small injury that would have closed up overnight in your 40s now sits there open for days because your blood sugar was spiking while you slept. And you have no idea because you're not checking at night. You're checking in the morning. And by morning, your blood sugar might be back in normal range. You think everything is fine. Meanwhile, your feet spent the entire night in a high glucose environment where healing was impossible. I had a patient named Robert, 68 years old. His morning fasting glucose was beautiful, 95 to 105 every single day. Perfect control. And yet he developed a non-healing ulcer on his big toe that took 9 weeks to close. We couldn't figure out why. So I had him start checking his blood sugar at 2 a.m. just once. One night, it was 227. 227. At 2 in the morning, while his body was supposed to be healing. He had no idea. Turns out his evening snack was spiking his glucose in the middle of the night, and it was staying elevated for hours. Once we fixed that, his wound started closing within a week. How many diabetics are checking their blood sugar at night? Almost none. And how many of those have nocturnal hyperglycemia that's sabotaging their healing without them knowing it? The majority. Here's the specific fix. For 1 week, set an alarm for 2 a.m. Check your blood sugar. Just once a night for 7 nights. You need to know what's happening while you sleep. If it's elevated, if it's above 140, you need to talk to your doctor about adjusting your evening medication or your nighttime eating. This is not optional if you're over 60 with diabetes. Your feet cannot afford 6 hours a night of impaired healing. Starting tonight, check once tonight, 2 a.m., see what the number is. Then you'll know. 4. And this is the one I missed for years. The temperature of the water you use to wash your feet. I know that sounds absurdly specific, but here's the reality. Diabetic neuropathy doesn't just kill pain sensation, it kills temperature sensation. You cannot accurately feel how hot the water is. A healthy person steps into a too hot bath and immediately pulls their foot out. A person with diabetic neuropathy steps into scalding water and feels warmth but not pain. By the time they realize something is wrong, they have second-degree burns on the bottom of both feet. I see this every single winter. Patients who soaked their feet in hot water to warm them up, or who stepped into a bath without testing the temperature first, and ended up with burns that took months to heal. Some never healed. Some led to amputations. Here's why this matters more after 60. Your skin is thinner, it burns faster, and your healing capacity is lower. A burn that would have resolved in 2 weeks at 40 now becomes a chronic wound at 65. I had a patient lose 3 toes because she soaked her feet in water that was too hot. She didn't feel it. She sat there for 20 minutes watching television while the water slowly cooked the skin off the bottom of her feet. She only realized what had happened when she stood up and saw that the skin was peeling. By then, the damage was done. The burns got infected. The infection spread to bone. We had to amputate. The fix is simple. Never put your feet in water without testing it first. Not with your foot. With your hand. Your elbow. Use a thermometer if you need to. The water should never be above 95 degrees Fahrenheit. Lukewarm, that's all. If it feels hot to your hand, it's too hot for your feet. And if you can't feel temperature accurately in your hands either, then you use a thermometer. Every time, no exceptions. This is especially important in winter, when people are tempted to warm their feet with hot water or heating pads. Heating pads are a disaster for diabetic feet. You fall asleep with a heating pad on your foot. You wake up with a burn. I've seen it dozens of times. If your feet are cold, wear socks. Warm socks. Not a heating pad. Not hot water. Socks. 5. This one is the hardest to talk about because it involves something most people don't want to hear. Alcohol. Even small amounts. Even occasional use. Here's what happens. Alcohol impairs your immune response. It suppresses white blood cell function. It interferes with wound healing. And in a diabetic body that's already struggling with compromised immunity and impaired healing, even 1 or 2 drinks can tip the balance from healing to non-healing. I'm not talking about chronic alcoholism. I'm talking about a glass of wine with dinner 3 times a week. That's enough to slow wound healing in a diabetic over 60. After 60, your liver's ability to process alcohol is diminished. The same drink that cleared your system in 4 hours at age 40 now takes 8 hours at age 65, which means your body is dealing with the toxic effects of alcohol for twice as long. And during that time, healing is impaired. Immune function is suppressed. If you have an active wound, even a small one, alcohol is preventing it from closing. I've had patients with non-healing ulcers who were doing everything right except for one thing. They were having 2 glasses of wine every evening. When they stopped, the wound started closing within 10 days, every time. Does that mean you can never have a drink if you're diabetic and over 60? No, it means you need to understand the trade-off. If you have any active wound anywhere on your body, alcohol is working against you. If your feet are completely healthy, an occasional drink is probably fine. But if you've noticed any slow healing cuts, any skin breakdown, any infections that seem to linger, you need to eliminate alcohol completely until everything is healed. Write that down. No alcohol during active wound healing. Not even a little. Your body can't afford it. I want to be honest with you for a moment. Not as a content creator, as a surgeon. I have stood at an operating table at 3 in the morning holding a foot that we couldn't save. I have spoken to families in waiting rooms at dawn, families who had no idea anything was seriously wrong when they said goodnight 12 hours earlier. The husband who went to bed with a blister and woke up septic. The wife who thought her foot infection was getting better and ended up in the ICU with necrotizing fasciitis. In case after case, the contributing factors were not mysterious. They were ordinary things. Shoes that didn't fit, feet that hadn't been inspected in weeks, blood sugar that spiked every night while they slept, water that was too hot, a glass of wine that seemed harmless. These are not exotic risk factors. They are the background noise of millions of ordinary evenings. And that background noise, accumulated night after night, week after week, year after year, erodes the thin margin that stands between healthy tissue and amputation. I want to tell you about Richard. That's the patient I mentioned at the beginning. 64, retired teacher, the man with the blister on his heel. He came to me after 3 weeks of trying to manage it at home. By the time I saw him, the infection had reached bone. We spent 2 months trying to save the foot. Hyperbaric oxygen, IV antibiotics, surgical debridement. We did everything, but the tissue was too damaged. Too much time had passed. In the end, we had to take the leg below the knee. 6 months later, he came back for a follow-up. He was walking again, doing well with his prosthetic. And the first thing he said to me was this. He said, "Why didn't anyone tell me I needed to look at my feet every day? I saw my endocrinologist every 3 months for 20 years. Nobody ever said that. If someone had told me, I would have seen that blister on day 1, not day 21. That question has stayed with me. It's a big part of why I make videos like this one. So let me summarize. 5 things. Number 1, inspect your feet every single night before bed. Use a mirror. Check for anything that wasn't there yesterday. Number 2, get properly fitted diabetic shoes from a certified podorthist and inspect the inside of your shoes before you put them on every time. Number 3, check your blood sugar at 2 a.m. at least once this week to see if you have nocturnal hyperglycemia that's sabotaging your healing. Number 4, never put your feet in water without testing the temperature first with your hand and keep it below 95 degrees. Number 5, if you have any active wound, eliminate alcohol completely until it's healed. Which of these 5 risks are you living with right now? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who is over 60 and living with diabetes and who needs exactly this information. Send it to them. That one share might be the most important thing you do today. Every week, I bring you honest, evidence-based information that I wish every one of my patients had access to long before they ended up in my operating room. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a vascular surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your feet have been carrying you for 60, 70, 80 years. Every single day, every single step, without ever asking for anything in return. Give them this. Take care of your feet.